What is a scarless breast augmentation and how is it different from other forms of breast augmentation? Now, in plastic surgery, there's never no scar. We always have to create some scar when we make an incision on the body. But we can do things such as suture an incision to the best of our ability so that the scar is minimal. To go beyond that, we hide scars in natural creases, wrinkles, shadows of the skin so that when things heal, they're very difficult to see, almost like camouflaging them. So when I came to Hawaii, I noticed that I had a lot of very petite women, and even in women who aren't petite, they have small nipples and areolas. So there are two usual incisions for a plastic surgeon to put an implant, a breast implant, into the chest. The first one is beside the areola, which can work really well. It can be camouflaged right at that dark edge and the lighter skin around it. And if that works out, things are great. But I have noticed that a lot of patients have come to me and that wasn't possible to do. The reason why I couldn't do it is because the nipple and areola was so small. Smaller it is, the less likelihood that a larger implant is going to fit through that incision. So you can imagine if somebody's areolas is very, very small, we can't make a long enough incision to put an implant through. These days, almost all implants that we place are silicone implants. Those are filled with silicone, so they're as big or as large as they need to be to get to that certain size. Way back when I first started practicing 20 years ago, we were using saline implants. And saline implants you can deflate completely, roll up like an enchilada, and put it through a very small incision and fill it with a tube connected to a syringe. And that way you can use a really small incision, but yet put in a very large implant because you're filling it outside the body when it's inside the chest. Silicone implants are totally different. They're already filled with silicone when we get them, and we have to make a big enough incision to put that implant in. So the only other choice that most other plastic surgeons can offer is an incision underneath the breast. Now, that's the standard way that you're going to get a breast augmentation if you go to, I would say, 99% of plastic surgeons. It's a safe method. It's what we're taught to do initially. It has what most people will say total visualization, or the ability to see everything that you're doing. People think that it's really what we call the gold standard. It's something that everybody should use, know how to do, compare any other technique to, because that is the safest and the best way. But I would argue that it's the worst scar. Now, if a patient's breast is large and it hangs over the chest a little bit, has a little bit of a natural droop, that fold where the breast meets the chest is going to be quite high and camouflage, which is great. So surgeons can place the scar either right in that fold, or when I do use that incision, slightly above the fold, so that if a bra or bikini rides up, the scar is going to be right there visible. Well, the surgeon has the choice of hiding that scar underneath the breast, and often that can give a good result. Now, if you take a smaller woman, one with not as developed a fold, a smaller breast, very smooth skin, like a lot of my patients here in Hawaii, who a lot of them are Asian, that scar can be quite visible. It's right in the middle of the breast. That bottom of the breast is completely visible, looking at it from straight on. So it becomes a very obvious scar, and the longer the scar is, the more visible it is. Some women have very smooth, delicate skin, and a big scar in the middle of that, especially if the scar becomes a little more visible, can be quite apparent and obvious. Even that incision beside the areola has some certain problems. Now, if that scar is more visible for whatever reason, like all patients can form more visible scars, then that scar is going to be right in the middle of the chest. Every time the patient looks in the mirror or is with a loved one, that's going to be in the center of their breast. It's going to be very visible, and you can't really get rid of it once the scar is there. Other problems that I see with that incision are sometimes it can be very indented. Scar tissue can form and draw in that scar, and then that indentation is very strong, and it's something that needs to be fixed, or else it doesn't look quite right, and that's right in the middle of the breast. So you can have problem scarring, you can have okay scarring. In some cases, these scars can turn out really well, but if you don't end up with an ideal scar, then that's a problem, and it can be very visible. So I thought, well, what's the other option? The other option was to go through the belly button. Only saline implants are done that way. I feel it's very unsafe because it's what we call a blind approach. So in surgery, you want to see everything you're doing. If you don't see what you're doing, then I feel like you're not really doing the best job. When you see what you're doing everything precisely, exactly the way that you want. You're seeing what you're doing, which is really important for anything, I think. But there are what we call blind approaches in surgery, where basically you use something blunt, you use something large, and you force open a space inside the body to do something with, in this case, put in an implant. So they used to do that through the belly button with saline implants, where you could collapse and put through a tube, and that would reach from your belly button to your breast. But I feel it's unsafe and not very precise and not the best way to do things, so I never did surgery that way. The other way that I've been taught or exposed to was an armpit incision. Now, there are two ways to put an implant through an armpit incision. One is the blunt, blind approach, and I don't feel it's the best way to do surgery. Some of my colleagues do it, and they have great results, but I can't do the surgery that way and give patients results that I want and do it as safely as I want to. I use what's called an endoscope. Endoscope is a special camera that's hooked up to a TV screen, and that allows me to use an armpit incision to see everything I'm doing, do everything precisely, exactly the way that I want, with the symmetry that I need, control all bleeding, and do the surgery just as well as any surgeon could with an incision on the breast, which is the gold standard that I talked about, but I can hide the scar on the armpit. The armpit is an area of very thin skin. We do know that thin skin always heals better than thicker skin. Thicker skin, such as the middle of the chest, the knee, the elbow, the shoulder. Those are areas under higher tension, thicker skin, and we do believe that thicker skin doesn't heal as well as thinner skin. Thinner skin we find in the armpit, the eyelid. Those are all areas that, even though we create incisions there, generally they heal better than in areas with thicker skin. Now, the other thing I like about hiding the incision in the armpit is that you have these natural creases or wrinkles in the armpit already, and those are already a little bit dark. They already actually look like scars. So what's more ideal than putting an incision in an area that already looks like a scar, because if you do a great job at suturing, it's just going to look like how it did before. And that's what we often find. Although we do sometimes have problems with scars in the armpit, it's very rare, and I can treat it in one way or another, either with surgery, laser, injections of steroid, and so on. Usually the scar ends up and you can really barely see it. And that's how I can call this surgery scarless. It's not really scarless, but because I hide the scar, it's very difficult to see. Sometimes it's difficult for me to even find. I can call it a scarless breast augmentation. So if you're interested in breast augmentation, please consider this. You can seek out myself or another plastic surgeon that can offer you a scarless endoscopic armpit incision breast augmentation, because I feel it's the best scar. And in many other ways, it's a safer way to do the procedure, more technologically advanced. And I think it's the very best way to do breast augmentation, knowing all the other methods that are possible. Thank you for watching this video. If you like this video, please smash up the like button, subscribe to our channel so we can create more content like this for you.